Let's take a step back and get into your story now. Going all the way back to when you were 100 pounds heavier,
Yep.
morbidly obese.
Yep.
You wouldn't be saying any of the current stuff that we're talking about today. You're very conventional minded. Take us back to that time and talk about what your lifestyle and diet was like, and then we'll go through the evolution to where you are today.
Yeah, sure thing. So, this is throughout my early career as a heart surgeon. The first 10 plus years as a heart surgeon, I was increasingly unhealthy. I was morbidly obese. I was pre-diabetic, and I realized that I was destined for my own operating table. I had the whole story, family history. My grandmother, battled with and died of heart disease. My dad has undergone heart surgery. So, all of the boxes were being checked. And I didn't know what to do because I had tried and I was following the advice that I had learned to give. Counting my calories, eating less, moving more, eating a low-fat diet. I had had some short-term successes like many people have. I'd lose some weight and then I would end up gaining back the weight and more. And it was only when I started getting exposed to different information and started learning about elimination of sugar, elimination of carbohydrates, low carbohydrate diets, and ultimately carnivore diets, that my personal health improved. That I have been able to undo all of that. I no longer struggle with obesity. I have lost 100 pounds. I have maintained that weight loss. Now we're over 7 years at this point into this journey. I am literally in the best shape of my life. I have more energy than I did, 10, 15, 20 years ago. I wear smaller clothes today than I did in high school. And so it has had a vast impact on my personal health. And now I have seen patient after patient that I've been working with get similar improvements. And, that's why I'm doing everything that I do. That's why I wrote the book. That's why I have my telemedicine practice to work with people on this, coaching programs, courses, coming on podcasts like this, and running my own podcast, because my mission is to get this information to as many people as possible and to help them to take back control of their health.
You talked about the fact that making meals is easy for you following this diet. The weight loss speaks for itself. So we're hearing about, all the different positive aspects of this new diet. Not new, but I guess within that 7-year range. How long have you been carnivore? Is it 2 or 3 years?
I've been carnivore now for 4 years. And I really started my journey through the various flavors of low carb, low carb, keto, all of that stuff started now 7 years ago.
What I was getting at with all that is, do you find with this diet, there are any specific challenges, or it's just become easier in all realms?
No, it really, again, it just becomes your lifestyle. Most of the challenges that people sort of perceive or come to me with, just get overcome. They ask about things like, well, how do you eat out? How do you travel? Which are things that I do, a lot, the travel especially, the eat out less so. But these are all things that I incorporate into my life without issues. You can work around all this stuff. One of the most powerful things I find about the carnivore diet, and really this applies to low carb diets in general, is the hunger control. And so when you're hungry less often, you can be better about making those intentional choices. One of the reasons that I think in day-to-day life, most people make such poor choices around the food that they're eating is because they're hungry all the time. So they just need to grab whatever's around them to eat to keep their hunger at bay. Hunger is one of the most powerful human instincts that we have. You really cannot resist hunger. We talk about willpower, and again, this goes back to the traditional dieting approach that makes you more hungry. And, over time, you simply cannot resist that, because hunger is one of our basic survival instincts. So when you eat in a way like a carnivore diet that makes you hungry less often, that is a very powerful tool. So if I'm in situations where there just isn't, what I consider to be good food available, I'm okay with going a little longer not eating. And that makes it a lot easier to negotiate things like travel, for instance. But even forgetting that for a minute, there really isn't situations where you can't find something to eat that's going to be carnivore. Almost every restaurant serves burgers and steaks, and so you just eat the burger and you tell them, I don't want the topping, I don't want the buns. And people are going to be like, well, how do they react to that? Honestly, no one even blinks an eye at it anymore. I think low carbohydrate has become accepted enough into society, still not nearly mainstream, but it's accepted enough that no one really looks at it. And if they accidentally bring you the burger on the bun, you just put the bun on the side, you eat the burger, and you're good to go. And so it is very easy to do in day-to-day life. I think most people would say that I lead a very busy, hectic life as a heart surgeon, running businesses, doing all of the stuff that I do. And I'm able to make it work. And it actually facilitates all the things that I do, because I'm not thinking about food as much, and I'm not stopping to eat, as much. And I have endless energy. That's one of the other great things about low carbohydrate diets, about improving your metabolic health. You find energy improves, your mental clarity improves, and it really does allow you to function better.
As you talk about the fact that you're not hungry and you have this energy, it gets me thinking about intermittent fasting. And it sounds like, and I know you talk about this briefly in your book, you're not a fan of overtly doing that. Would you say for people that haven't adopted a full carnivore diet, though, there would be benefits if there's still, a moderate amount of carbohydrates? Because again, this all comes back to insulin resistance,
Yep.
not spiking the glucose. There's two different avenues when it comes to diet that we can attack that. One being having windows where we're not eating, letting blood glucose come down,
Yep.
and the other being having lower carb foods. So in your case, maybe fasting wouldn't be as applicable. So I'll have you talk about that. And then for somebody who is having a moderate amount of carbs, would you say that tool would be more applicable in that case?
Yeah, so reducing your frequency of eating is certainly a powerful tool in improving metabolic health. And again, it's not that I'm not a fan of intermittent fasting. I just don't think it's the first lever necessarily to pull, because if you get into that situation where you're trying to force your way through it and you're hungry, as I said, that becomes very difficult to maintain over the long term. So I try to go at it from the other approach, and I tell people, find a way to eat that's going to make you hungry less often. And, low carbohydrates do that very well. You don't have to be full carnivore, to get those benefits. I find most people on low carbohydrate ketogenic diets, over time, they just become hungry less often. At the beginning, one thing that I point out to people, though, is that you may get more hungry at first. Because when you've eliminated the processed food and you're starting to give your body nutrient-dense food, your body craves that. It wants more of that. It wants to recover from the nutrient deficiencies that many of us have on processed food diets. And so you might get more hungry at first. And I also tell people, don't fear that. Sometimes you do sort of lean into it. And those are the situations where I don't necessarily want people forcing themselves to fast for certain periods of time, because, that can get us into a situation where it's just not sustainable. And ultimately, you get so hungry that you just, all of a sudden you're eating stuff that you don't want to be eating necessarily. So That's my message around the fasting part of it. But intermittent fasting, even longer fasts, which sometimes I use with people as well, can be very powerful tools for improving your metabolic health.
How do you feel about food quality? As somebody that's eating primarily meat, are you concerned about getting organic, free range, grass fed, grass finished? Or for you, is that very secondary?
Yeah, so it is a secondary concern, and again, what I tell people is find the animal protein, find the meat that's accessible to you, affordable to you. I'd rather have you eating, lower quality, what's perceived as lower quality meats, than eating processed food. If it's just not available in your area, if it's not affordable to you, I know many people who have had great success doing carnivore-based diets on, what would be considered low quality meat, the ground beef that you get for $2.99, $3.99 a pound, in the supermarket or in the bulk, amounts. But there are ways of getting higher quality meats at lower prices. Connect with a local rancher, go direct to the source. And that can save a lot of money when you cut out the middleman. If you can buy it in bulk, if you have the ability to store it, and you can buy a quarter cow or a half cow at a time, you can get a really great value on higher quality meats. Ultimately, when we look from a nutritional standpoint, the difference between, ideal grass-fed, regeneratively raised, beef versus the kind of standard, what we call CAFO beef, the large quantity beef raising organizations. That nutritional difference is actually relatively small compared to the nutritional difference between beef in general and, processed food. So you have to make it work in your life. And again, it can be very affordable. Because you're eating less frequently, it becomes more affordable. Because you're wasting less. People don't really recognize, how much of the processed food, that we end up throwing out, how much waste there is in that system. You're eating, and again, how much of it your body is actually utilizing. Our body is able to optimally extract the nutrients from animal products. We're not able to extract it from plant products. A lot more of the plant products that we eat pass through us and, out the other end than with animal products. So that's another factor that goes into this. So when people are thinking about affordability, you have to consider all those factors. And the final factor that should go into your affordability equation is what's it costing you in the long term to eat that processed food? Yes, that processed food is cheap now, but what's it costing you in the long term? If you're going to be sick, if you're going to be requiring medications, if you're going to have reduced quality of life, what is that worth to you? And that really, balance that against the investment that you might have to make in eating higher quality, non-processed food.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
What I try to get people to understand is that a carnivore diet is a healthy diet. It is a heart healthy diet. Weight loss really becomes a side effect of improving your metabolic health. And the unfortunate